All right, hello everybody. We're going to be going over concussions and the pathophysiology of what's going on during a concussion. So here we can see a normal neuron receiving a signal traveling down the axon to another cell and releasing neurotransmitters organically, triggering the next cell. When a concussion occurs, potassium begins to leak from the stretched cells. This in turn increases demand for glycolysis, otherwise known as hyperglycolysis. As potassium is leaking out, toxic calcium rushes into the cell, causing an imbalance and metabolic dysfunction within the cells. With this imbalance comes an increased demand for energy. Communication between the cells is also impaired due to being overwhelmed by neurotransmitters, leaving the nerve extremely vulnerable to further damage and possible cell death. Following a concussion, it will take many days for the chemical imbalance to heal and reset so that the cells can function as they normally do. The importance of safety during the injured state cannot be overstated. And we can use clinical profiles to further assist our athletes and put them into categories that their concussion might fall into. As we know, not all concussions are the same, and they need to be treated as such. These categories for clinical profiles include vestibular, ocular, cognitive fatigue, migraine, and anxiety and mood. Each of these describing the brain function that was most impacted during the concussion. If we can use these categories, it can help further um, center our care around our patients for providing optimal patient-centered care. Patient-centered care will result in the overall best outcome for our patients, which is our number one priority. If we treat all concussions with one standard protocol, some patients may heal in a timely manner and have no downside to their recovery period, while it may not work the same for others. So we have to take into account the symptoms that they are presenting and try to combat those symptoms with the best possible way we can.